Hey everybody, welcome back to Drug Talk. My name is Garrett Campbell. In today's video, we're going to be doing a simplified version of our previous video we made on Lorazepam or Ativan, and we're starting right now. So to start this presentation, we'll discuss what this medication is used for both officially and unofficially. So officially, this medication, Lorazepam or Ativan, is typically prescribed for anxiety, difficulty sleeping due to anxiety. It can be used for a pre-medication before some procedures, and it can be used for some severe situations related to seizures. Unofficially, or an off-label use for this medication, would be agitation related to some disorders, usually psychotic disorders. It could be unofficially used for sedation or alcohol withdrawal syndrome, as well as nausea and vomiting associated with chemotherapy, and finally here for seizures. Next here, we'll touch on how to use this medication. So the first and most important thing with this medication is to take your medicine as directed. Your dose may need to change several times to find what works best for you, but just make sure that when you're using the medication, you're using it as prescribed by your physician on the prescription. It's important to note here that this medicine is not for long-term use. And what do you do if you miss a dose? So you would take a dose as soon as you remember, but if you're more than 1 hour late, then you would skip the dose and wait until the next time for your next dose. So do not use an extra medication or an extra dose to make up for a lost dose or a missed dose. Now over the next couple slides, we're going to go through a couple warnings associated with this medication. So first off here, it is not safe to take this medication during pregnancy. It could harm the unborn baby, so tell your doctor right away if you become pregnant. Also tell your doctor if you have kidney disease, liver disease, lung or breathing problems. This would include COPD and sleep apnea, or a history of drug or alcohol abuse, depression, mental problems, or seizures. It's important to note here that this medicine may cause the following problems. The first being an increased risk of overdose, which can be life-threatening, difficulty breathing, which could become severe, especially when the patient is using narcotic pain medicines with their Lorazepam or Ativan. And they also may experience unusual thoughts and behavior. Continuing on with warnings, this medicine can be habit-forming, so do not use more than your prescribed dose. Call your doctor if you don't think it's working. So if you don't think the medicine's working, don't use more of the medication. Just call your doctor and you can come up with a plan of how to move forward. Do not stop using this medication suddenly. Now this could be different in some situations where people are just using it as needed, but if you're using it consistently, then don't stop the medication suddenly. Your doctor will need to slowly decrease your dose in some situations. This medicine may make you drowsy, so do not drive or do anything that could be dangerous until you know how it makes you feel. And to finish off the presentation here, just a couple of notes here regarding side effects. So these side effects are ones that you would call your doctor right away. If not able to get a hold of your doctor, you would probably present to the emergency room if you have any of these. So the first one would be an allergic reaction, so itching or hives, swelling in your face, your hands, swelling or tingling in your mouth or throat, chest tightness, trouble breathing. The next one would be blue lips, fingernails, or skin, trouble breathing, chest pain. If you have blurred vision, change or loss of consciousness, dizziness, faintness, lightheadedness, or problems with coordination, you should see a doctor right away. As well, if you have confusion, unusual mood or behavior, thoughts of hurting yourself, if you have seizures, or severe drowsiness or weakness, or slow heartbeat. And lastly here, if you have worsening of depression. So keep in mind, these are all side effects that if you experience these, you should talk to a doctor right away. Other side effects that you would just talk to your doctor at your earliest convenience would be things like drowsiness that aren't as serious. Alright everybody, that's all we're going to talk about today with Lorazepam or Ativan. Remember, if you enjoyed this video, click the like button and subscribe, and we'll see you next time.